Today, the UK's National Health Service is warning that anyone with a history of adverse reactions to vaccines should not get the Pfizer shot. This comes after two people, both staff members of the NHS, had reactions to the shots that they received yesterday. Joining me now from Pittsburgh is Amish Adalja, senior scholar for the Johns Hopkins Center for Health Security. Amish, good morning. It's good to see you. So clear this up for us, doctor. What exactly happened to these two patients, and who should be careful about getting the vaccine?
So what it looks like, and from what we're hearing from the UK authorities, is that two individuals, both healthcare workers who were vaccinated, had what are called anaphylactic reactions to this vaccine. So that's a severe allergy. And usually there's some component that's in the vaccine preparation that's cross-reacting with something that they're known to be allergic to. So I think the question is trying to figure out what these people are allergic to and then making a decision on if that should change who should be getting this Pfizer vaccine. So for right now, the UK government is saying if you've had a history of an anaphylactic reaction to anything, if you're somebody that has to carry around an EpiPen, you should not be getting this vaccine. But I think we'll learn more. And this wasn't something seen in the clinical trials, and it illustrates what happens when you move from smaller populations in the clinical trial to the general population, that there are going to be rare side effects that do show up.
Yeah, that was going to be my next question, is if we saw anything like this in the data from the clinical trials. So given that we didn't, is it pretty typical when we see the rollout of some sort of new vaccine or some sort of new medication that we do start to see things that we didn't see in the clinical trials, and that causes public health officials around the world to sort of change their recommendations and continue to hone them in as to who and who should not get something?
Yeah, that definitely happens. You have to remember that even though our clinical trials were big, tens of thousands of people all over the world for these vaccines, it's not the same as vaccinating the general population or billions of people or hundreds of millions of people. So if something happens 0.01% of the time, there might not have been enough people in the clinical trial to see it. So this is kind of the value of bigger numbers, and you see certain things that are rare come to light. And I think it doesn't necessarily change anything. I would line up for this vaccine today if I had it, but it is something that we have to watch, and we do give people guidance based on the risks and benefits that they may face. And vaccines ideally are precision guided, so you need to know what risk factors a person has for a severe disease, and then make recommendations to that person individually. And there may be a recommendation regarding allergies as we go forward.
So Dr. Adalja, just give us your thoughts on how the vaccine rollout went in the UK, what we learned, and what you're thinking about 24 hours later.
So we're just on day 2, so we don't quite know how it will completely go, but they're doing something similar to the United States, vaccinating those who are above the age of 80 and healthcare workers. And so far, it appears to be looking good. I think we'll learn a lot from how this works, how the logistics of the cold chain, because remember, this vaccine needs to be kept -70, -80 degrees, how receptive people are. And we'll also want to look and see to make sure that everybody comes back for their second dose in the UK. So there'll be a lot of eyes on how the UK progress goes. And when they move from their high-risk population to the next tier, all of that's going to be really important to help us understand how we'll do this in the next coming weeks and months.
So one thing I've been wondering about when it comes to this vaccine, which requires 2 doses, as opposed to some other ones that don't necessarily require 2 doses, what happens now for the people who have received the shot? What do they do for the next 4 weeks in terms of protecting themselves from getting COVID? What happens if they do get COVID? And then what can they expect 4 weeks from now?
So I think it's a 3-week gap between the two doses is how they do it. But what you expect is about 7 days after the first dose, you're going to start seeing some of that immunity kick in. And if you look at the Pfizer data, they have high protection after the first dose. So they're probably going to be much less likely to contract COVID-19. But that doesn't mean that they can stop taking the common sense precautions, that we want people to still wear a face covering, avoid crowded and congregated areas, wash their hands, try and stay 6 feet apart from people that are not in their household. We want people to continue to do that in between these doses. I think that there's probably in the first 7 days or so, if you came down with COVID, it's likely because you were incubating it at the time of the vaccine. After that, I think it probably will become increasingly less likely. And after the second dose, as we've seen, this isn't something that is very common to occur, to have symptomatic COVID.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.